Hello, you're watching the live stream of our weekly show, The Virus, to answer your questions about the COVID-19 pandemic. Australia's coronavirus fighting efforts are centred on Melbourne yet again this week, with clusters identified in 10 suburbs there. So feel free to leave your questions in the comments below and we'll get to as many of those questions as possible. Joining us this week is the epidemiologist and associate professor at La Trobe University, Dr Hassan Valley, and this is our national medical reporter, Sophie Scott. Welcome to both of you.
Hi, Jeremy.
Now, Dr Valley, you're joining us from Melbourne in one of these hotspots, in fact, where people are being diagnosed in greater numbers. I wonder if you could tell us what it's like being there for those of us watching anxiously from elsewhere in the country.
Yeah, look, it's really interesting because, up until a few days ago, it was really noticeable that people were really enjoying their freedoms and you just got a sense of things heading back to normal. But then, we've had a little bit of a shock and you can really see it out in the community. It feels a lot quieter now. And so clearly people are taking this upswing in cases quite seriously and are a bit concerned.
Sophie, what are your thoughts on this cluster breaking out in Melbourne?
Is of concern from the outside looking in, but listening to the experts, they're saying that this is really something they expected to happen. They expected that given we don't have an eradication strategy in Australia, that we've got an elimination strategy, that there would still always be some low level of virus circulating in the community. And what we're seeing in Victoria is just a higher level of that low level of virus. And so they're saying this is what we are prepared for. And this sort of rapid rolling out of testing is what they thought would be happening. And for example, it happened in northwestern Tasmania where they had the outbreak there. And they're saying sort of this outbreak in Victoria is really a test case for what might happen in the future. They're doing a massive amount of testing. I think they've sent 800 workers to do up to 10,000 tests. So that's a really phenomenal amount of testing if you can think about the number of labs and the number of people and the technology involved. So this is an important test case, I think, Jeremy, to see how quickly we can get on top of these outbreaks.
Dr Valley, from the inside, as the health experts are saying, as Sophie just said, this is very much under control. It's not an out-of-control situation at the moment. However, we are seeing, grocery restrictions, talk of border closures, and the sorts of measures that we've all just emerged from. And then you're hearing people from these communities, and I hasten to say it's not all of them, but people saying things like, I've been out and about, everyone has. I haven't met a person who has got coronavirus. It's not deadly, it's like any other virus. I'm not going to stop my life because of coronavirus. I've got work and a business to run. It's only killing elderly people, so what's the big deal? In our community, everyone hugs, so what's the big deal? We're crushing a peanut with a sledgehammer. Those are some of the quotes coming from the neighbourhood of Broadmeadows, and this is not an unusual sort of reaction that we've seen throughout this pandemic when people are saying this is the way they're sort of managing this crisis. What's your view about that?
Yeah, look, I think it's one of the challenges we have in public health and one of the challenges we have in Australia, and it's being faced throughout the world. And in some situations, it's a challenge that health experts are having to face in convincing governments to act appropriately. There's no doubt this is a serious event, and you only have to cast your eyes to Brazil and to look back at what happened in Italy to see the kind of effect that uncontrolled transmission can have. I suppose we're just going to have to keep this communication going and keep giving people information and hope that people act responsibly. And it's not just for themselves, but some of these young people who feel bulletproof, they have parents that they care about and grandparents, and they're at very high risk of serious consequences. So we just have to keep working to convince people, I guess, to come on board. And I guess to end on a positive note, I mean, a lot of people are taking this incredibly seriously and are acting incredibly responsibly, and that's why we're in the good situation that we're in. And I guess I just pick up from what Sophie said, that this is a bit of an upsurge, but relative to other places, we're doing incredibly well. And that's because of a lot of hard work from a lot of people and a lot of sacrifices.
Do you have a sense, Dr. Valley, about what the issue here is, why Melbourne is particularly seeing these clusters breaking out?
No, look, I think, we don't know, and there's got to be an element of luck involved. And I guess it really is a lesson that this is what could occur, and it was predicted. And there's no reason why what we're seeing in Victoria now won't happen in New South Wales in a few weeks' time. So it's just part and parcel of having cases in the community when you relax restrictions, because if you relax restrictions, you bring people into closer contact with each other or into more contact with each other, and you're always going to have these periodic upswings. And the most important thing is that our health departments have prepared for this, and they're responding pretty rapidly and decisively to try and squash transmission. And that's why they're doing all the testing, and that's why they've got these teams visiting these high-risk suburbs. So we're probably going to have to get used to this for the next 6 to 12 months.
Sophie, for those watching from other states and territories, I know we've even got viewers from overseas as well. What's the cautionary tale here? What lesson do we take away about preventing these clusters breaking out, or is that out of our hands?
Well, look, I think it's a harder public health message to sell. When we were in lockdown, we all knew you can't go outside, you can only go outside to, exercise or do your shopping. Now it's much more complicated than that. But what hasn't changed is the social distancing, and that's to stay a certain distance away from people. So even if you're in the same household or the same environment, you're really not supposed to be getting too close to people. And so that's the thing that we need to keep in mind. And they've been tracking social distancing, and they found when the peak of the lockdown was happening that 80% of Australia was practicing social distancing. And that's now gone down to 25%. So most of the people are not keeping their distance. And that's a problem, because no matter how good everything else is, if you're in close contact with people for a long time and there's virus circulating, it's going to spread. And so that's one thing we need to be constantly keeping in mind, that the social distancing is really, that's the key to stopping the spread of this virus, as well as things like good hand hygiene. And it's interesting to think about that. I don't know about you, but I haven't seen many of the public health messages on TV or coming up on my phone, and there seems to be a bit of a drop-off in the public health campaigns. And I think that's a mistake. I think we need to keep it in front of people's minds that even though the restrictions are being eased somewhat, those things, those basic things are still really, really important.
Sophie, I'm keeping an eye on the live stream, the feed coming through right now with a lot of the questions and comments people are leaving. And I want to tackle this question again, which we've tackled over and over again on this live stream, where people say, this is no worse than the flu. What's the big deal?
Well, look, I think the thing about that is if you were living in other parts of the world, I think fewer people would be saying that, because we've been very, very lucky in Australia that we've had a relatively low level of cases and a low death rate. But what we're seeing in countries overseas that have a lot more cases of this is just how serious a virus this COVID-19 really is. We've been looking into some of the long-term impacts or the intermediate impacts of people who have this virus, who are left with lung damage, heart problems, chronic fatigue syndrome. This is a virus that affects your ability to clot properly, blood vessel damage. It's not just like having a cold, and it's certainly just not like the flu where you get over it. We've even got people in Australia who are saying, they used to go to the gym 5 days a week. They can barely get out of bed. And so this is weeks after having the virus, and actually they thought that they'd be recovered by now. So in some ways, we don't know how bad it can be because we haven't really had it here, but we don't want to be complacent. We certainly don't want to end up like the United States. And it really can be a very serious illness and fatal for people who are in those high risk categories.
Dr. Valley, there are others who are anxious about this outbreak in Melbourne and wonder if this is the start of what they call the second wave, of the second peak. And I know you feel quite strongly about the terminology that we're using here and not trying to kind of overplay it somewhat. The term second wave has been bandied around quite a lot in the media. Is this a second wave?
Yeah, look, it's a really good question, and you're right, it is one of my sort of hobby horses. And the second wave is a very evocative term, and it is quite useful too, because it does sort of convey that we're seeing a subsequent peak in infections. But the reason I like to clarify this issue is because there can be a bit of a conflating of what is happening now with what happened during the Spanish flu. And the second wave in the Spanish flu was when the influenza virus, which is very different to coronavirus, kind of disappeared and then came back, and it came back in quite a different form. And when it came back in this second wave, it was much more virulent, or it caused much more severe disease. And that's when all the damage was done. So I'd just like to make that distinction, because in this situation, we're not really seeing that. We're not seeing a more virulent virus or a more severe disease. We're kind of seeing a continuation of transmission and what looks like happening in Victoria, a bit of an upswing. So it's just important to clarify that there's no signs that this virus is any different to how it was 2 months ago, but we are seeing we're potentially seeing an additional peak.
Sophie, do you have any sense of how long we can expect it to take to bring this second peak in Victoria under control?
Look, I think that's a bit of an unknown at this stage. Certainly, I don't know about you, but I get the sense that this week things have really ramped up again. When you look at the number of cases in Victoria every day, there have been sustained cases. I think it was another 30 cases today on Friday. So we're definitely seeing that every day there are cases. And certainly with National Cabinet meeting, Victoria and what was happening there was really one of the main things that they discussed at National Cabinet. So I think it's a bit of an unknown. I mean, I think seeing so many people getting tested is a really good thing. You know, the pictures of having these ambulances and vans on every corner and people getting tested really shows that they're making as much effort as possible to get it under control. As to when it will be fully under control, I think that's still a bit of an unknown, though.
Dr. Valley, do you have a sense of how long it'll take to come under control? I mean, a lot of people are leaving comments and questions here about, George has just left a comment saying build a wall around Victoria. But on a serious note, talking about border closures and whether people can and should travel between neighbourhoods in Melbourne and even out of Victoria altogether, what's your view?
Yeah, look, I mean, I think the most important thing is really get back to the basics. So as Sophie's mentioned, the first line of defence is social distancing. Then we've got our hand hygiene. Then we've got testing. So if we have any symptoms, we should get tested and we should be isolating. So if we do those things, then I guess keep abreast of any changes in policy from the health department. They're very basic things, but they're the things that are going to make the difference. So, right now, I think the Premier and the Chief Health Officer are asking people to just pare back a bit on the socialising and on their travel. And so that's a reasonable thing to ask of people right now, where we're just trying to bring under control, potentially serious situations. So I'd just like to bring things back to the basics.
Sophie, your view on this tension that's created by bringing things back to the basics and observing that social distancing versus states like South Australia continue to push ahead with reopening the borders to states such as New South Wales and Victoria, and then WA, which has still got a hard border closure?
Yeah, look, it's tricky. And also with coming up with school holidays, a couple of the states are having school holidays and people want to travel. They've had to stay at home and they haven't been able to go on a holiday. And so you can understand why people would want to have a break, but it is concerning and certainly difficult to patrol as well, because you can imagine Like, for example, the New South Wales Health Minister has said that they don't want people from Victoria coming up to New South Wales to go to the footy. But how do you really control that? And, so it's going to be very difficult, I think. And Gladys Berejiklian said we can't put a hard border in New South Wales, whereas in other states they do have a hard border. So, and the Northern Territory said you can't go up there if you're from one of these hotspots. So, it really is quite difficult when you think about it. There's no one clear message. And people really need to think about their own personal risks, I guess, if you come from one of these hotspots or if you don't. Basically, it's the risk is very individualised, and that's not normally what public health messages are about. Normally we can say, you must stay at home, you must do this, everyone must do it. That's not really the case with this. So that's why it's a little bit more tricky and probably more difficult for people to know what's the right thing for me to do. But yeah, I think what Dr. Valley says is right. Listen to the public health messages, listen to the Chief Medical Officer and take that advice on board.
Dr. Valley, Kristen asks really a very good question about whether it's time for Victorians to start wearing masks. Now, we've seen the public health advice change over time and diverging and converging again with what the WHO advises about the efficacy of face masks and the availability of face masks. What's your view?
Yeah, it's a really good question. As you say, it's coming up a lot, and there's a lot of people that are a little bit confused. So for me, it's fairly simple in that right now, the first line of defence is social distancing. And as I've said, hand hygiene and listening to the advice as it changes from the health department regarding, how we can move about and how many people we can get together with. But there's no doubt, and the evidence is clearer now, that masks offer another level of protection to people. And so this is, at the moment, in the absence of a sort of clear and sort of overarching guideline or instructions for people, this is another instance where people can make a decision based on their own personal situation and personal risk. So, for example, if someone has to travel on public transport and they know, the tram or train is going to be pretty full and they're not going to be able to socially distance, that's a sensible situation where you might wear a mask. The same situation would apply if you went shopping. So I think the message or the evidence is clearer now that masks do offer an additional level of protection, and we don't have the kind of shortages that we had early on in this pandemic. So one of the tensions early on was that we wanted to make sure there were enough masks for healthcare workers, but that issue is now resolved. So it is a useful supplementary intervention to lower your risk of getting infected. And, people at the moment, people should make a decision based on their circumstances.
And Dr. Valley,
Jeremy,
Sophie, go ahead.
I was just going to add that, you are seeing more people wearing masks. For example, in the Sydney CBD over the weekend, a lot of the big hotel chains, all their staff are wearing masks. And some of the big chains like Apple, for example, if you go into an Apple store, you need to have your temperature taken, and then you need to wear a mask while you're in the store at all times. So some places are taking it on board themselves to protect their customers and their staff by making people wear masks. And I think it's one of those things that the longer this goes on and the longer we don't have a good treatment or a vaccine, people are going to be saying, what else can we do? And like Dr. Valley said, the evidence is there that the masks are another level of protection. And so it's going to be something we're going to be seeing more of. And I think certainly in other countries like the United States, like Japan, wearing a mask is pretty much standard in most of those countries. And so as this goes on for longer and longer, I think we might see more companies taking matters into their own hands and just saying to protect their own staff and customers that you need to wear a mask.
And Rebecca has this question, Sophie, about whether they need to be those N95 masks or just a standard cotton one.
Well, I think the advice from the United States was that those fabric masks are actually probably the best, and that's certainly what you see a lot of people in the United States wearing. Or the normal surgical masks can work as well. I think the N95, certainly they were recommended when we had the bushfires and the smoke, but Dr. Valley might have a bit better information than I have, but I certainly think What's more available generally are the surgical masks, and those just, the homemade cloth masks certainly are something that were very popular in the United States. You see a lot of people, it's almost become a bit of a fashion item, having a cloth mask made out of a fancy material. So they're very, very popular.
Dr. Valley, do you make the distinction between what's taking place in the cities such as Melbourne right now? Carmel sent in this comment saying Melbourne is not the whole of Victoria. And you're seeing this frustration with people living outside the major cities, outside of Sydney and Melbourne, getting very frustrated by being sort of dragged down in some sense because of the outbreaks, these clusters that are taking place in places such as Melbourne. Do you make the distinction geographically about the level of risk in those areas?
Yeah, absolutely. And I guess this is one of the features of the current response to this upswing. And the health department has certainly identified high-risk local government areas within Melbourne, and advice and public health measures are being targeted to those areas. So I think it's a really important part of our response at this point to be very targeted to the different needs of different areas. And of course, part of this targeted response in Melbourne is the recognition that some of these public health messages might not have been getting out effectively to linguistically diverse groups. And there's efforts to rectify that. So I think there is a recognition of the diversity throughout Melbourne and Victoria in this response.
Sophie, you mentioned the several hundred testers that are going out in Victoria to try to collect these samples from people who may be infected, particularly in the hotspots. Talk us through how that's being done.
Well, basically, it's sort of, it's a massive operation. They've rolled out, they've got 800 people who are going to, for today, I don't know if you've seen the pictures, but it's really quite amazing seeing just such a huge number of people, ambulances on pretty much every second street corner, and also door knocking, asking people, do you want to have a test? The good news is the majority of people have been cooperative and said, yes, they do want to have a test. A small number of people have declined having a test because it is, not mandatory. But basically they've been able to roll out as much of these tests as possible, so much so that they're actually going to be sending the tests interstate because Victoria itself doesn't have enough capacity to process all the tests. So other states are stepping in and helping out. So that will hopefully speed up the process to get people's results back as quickly as possible. So it's really, like I said, this is a test case. What happens in Victoria could happen and may happen in other states, probably most likely New South Wales. So we need to see how well Victoria handles it and learn the lessons that what could they have done better, what needed to be happening more quickly, so that when it does pop up again, we can put those improved measures in place.
Dr. Valley, in relation to that AFL player who tested negative and then positive and then negative again, what happened there?
Yeah, look, I mean, that's a really good question. And of course, Victorians being very football passionate, they're all interested to try and understand this. And, the short answer is we're not sure. The longer answer is there are a few different possibilities. And obviously a lot of people are sort of jumping on the possibility that it could have been a false positive, so that this player is not actually infected. But I think that's a premature conclusion because it's very possible that this player has been infected and has been, if you like, incubating the virus, but that the levels of virus circulating in his body have not been particularly high. And so he's had that one positive test, then he's had a negative test. But there's no reason why, if you track this player for the full incubation period of COVID-19, that he may not start shedding virus and start testing positive again a bit later on. So I think the health department are treating this player as if he's a positive, which is as inconvenient as it is, of course, for the Essendon Football Club and for this player. I think it's a very sensible way to approach this. So yeah, just making the point that a lot of people have assumed it's a false positive, and I don't think we could jump to that conclusion just yet.
We had another question, Sophie, about whether we know where this spike in Melbourne came from, and the options being offered are people coming in from overseas and are in hotel quarantine. The protests took place a few weeks ago now, and that was a great opportunity for people to really mingle in close quarters. And then we've seen families as well not observing that social distancing. Do we have any idea yet about where this spike has come from?
Well, I think it's come from a number of places, but certainly today, when the Chief Medical Officer or the Deputy Chief Medical Officer from Victoria was talking today, she was really stressing the family gatherings, to say to people, extended family gatherings are a problem, and they will be a problem for a while in Victoria until this little spike or surge, whatever we want to call it, gets under control. So we know that they've come from a couple of different areas. She talked about a mental health worker who they think might have spread it to some people. Then they're not sure whether anyone from the protest has spread it, but there was certainly someone identified who had it, who went to the protest. And then hotel quarantine is where the majority of some cases have been found. But like I said today, she really did stress that the extended family gatherings, that's where they're really concerned. And they're basically saying to people, you must stick to the rules and not have big gatherings, because this virus can spread, and when it does, it can really spread a lot and be very virulent. So that's what the advice is today, and we really are hoping that they'll take that under consideration and follow it.
Can you put in a nutshell for us, Dr. Valley, why it is family gatherings appear to pose a bigger risk than a protest?
That's a good question. Look, I think firstly, we can't discount the probability factor or the luck factor in all of this. So there's no doubt that a gathering the size of those demonstrations could have seeded a large outbreak or a large cluster, but we were very lucky, and maybe that luck came from a combination of not having much circulating virus in the community, people wearing masks at that rally, and a few other things. It was outdoors. So, I think we were very lucky, but we don't want to have those sorts of demonstrations every week, because that would be pushing our luck. Clearly, one of the ways that people have started to enjoy their freedoms after such strict restrictions or strict lockdown was to get their families together. And I guess it's pretty, once again, from a human psychology perspective, when families come together to celebrate and to reconnect after not seeing each other for a while, there's that tendency to relax too much and to not observe social distancing and to hug and all that sort of thing. So I think we just need to continually remind ourselves that this is a serious situation that we find ourselves in, and we've done really well up until this point, but we can't drop our guard.
Dr. Valley, a number of questioners, including Kellyanne, who's just asked about what this means for schools, why schools are still running when we're seeing these outbreaks, and what does that mean for the future of the rest of the term, the rest of the academic year, when we're seeing these clusters popping up as they're expected to keep going?
Yeah, look, we don't have a rule book or a map for any of this, and some other epidemiologists have talked about this situation being like building a skyscraper while the plans are being drawn by the architect, or the plans are still being drawn up. And so we're going to have to make a lot of decisions as we go, watching the situation closely. What we do know is that children pose a much lesser risk in terms of getting disease themselves and in terms of disease transmission. So, but having said that, if this upswing were to continue, then we're back to where we were in the first stage of this lockdown, where we want to shut things down pretty harshly, I guess. So, it's hard to know. We have to just watch and see what happens over the next little while. And I guess part of part of what will happen will be how people respond to school holidays. So the Premier and the Chief Health Officer and the Deputy Chief Health Officer are asking us to exercise some restraint over these school holidays and not interact too much and limit, what we do. So hopefully with everything that the health department is doing to try and tackle this upswing, and if people play their role during school holidays, hopefully we can just start the next term as planned.
Sophie, you mentioned the school holiday period being a critical one in how this outbreak, these clusters develop, particularly in Victoria, and a number of viewers watching from regional Australia are also saying they're concerned about the mobility that you see during school holidays. What's your best advice about keeping all that under control, particularly as people head away from the cities?
Well, look, I think it's very individualised. Like the advice depends on whether you're from Victoria, whether you're from a hotspot, whether you're from New South Wales. Certainly, I think people need to be listening to what their health officers are telling them particularly. So the advice differs really where you live. Like, for example, Victorians have been told it's okay to travel in Victoria. You've seen, though, we've had images of people arriving from Victoria on planes in New South Wales, and some of the people in the places they've been arriving are saying, we're concerned seeing Victorians pile into New South Wales. But the other thing is it's difficult. You can't close borders completely, and those regional tourism operators, they want the people there. So it's not clear cut, because if you say to people you can't travel, you can't do this, then the tourism sector is going to suffer even more than they already have. So people just need to be sensible and heed the advice from their own health authorities. There's not one general message that goes for everybody these school holidays. So it's very individual, and it's also difficult, because you can understand why people might want a holiday. It's been a tough few months, and so you don't sort of say to them, well, you can't go on holidays, but you really need to think about what's best for you and what's safe, in this environment. Because, like Dr. Valley said, the next week or two is actually really important to see what happens in Victoria. If they can get it under control, that would be fantastic. But if they don't, we don't want to see us go backwards, and that's a possibility if we don't get this Victorian outbreak under control.
Dr. Valley, Nikki wrote to us via the ABC News webpage asking about Australia aiming for COVID-19 control and not elimination. Now, if you discount Victoria out of the current situation, the case numbers around the country are very low. So should the government be more ambitious in trying to eliminate rather than just seek to control the virus and cop the odd outbreak here and there?
Yeah, look, it's a really good question. And I think, I guess the first thing to say is right at the very beginning, we didn't know where we were heading. And it was a reasonable sort of aim to go for suppression, given what we understood about this virus. I guess the other point to make is that whether you go for suppression or elimination, you're effectively doing the same thing. I mean, the only difference is you've got a different end game, and you probably, or most likely, you'll be exercising restrictions that are a bit harsher and for a bit longer. So you can still be aiming for suppression in terms of that being your stated goal, but you could end up with elimination. As you've mentioned, a lot of states are pretty much there. So, to me, I feel like it's a reasonable path that we're on, and we've still got to go back and compare where we're at with the rest of the world, and we've just done magnificently. Now, if Victoria gets its situation under control, we may have set new goals basically, and go for elimination. I guess that's a possibility. It's not something that's been stated by any of either the federal government or any of the state governments at this stage. But once again, we're doing things on the run, and we're adjusting to the situation as it presents to us, and that's a possibility down the track.
Dr. Valley, do you have any sense of how widespread antibodies would be in the population from just having exposure at some stage during the course of this pandemic?
Yeah, look, that's a big unknown. I mean, I guess what's interesting is that even, in the early days when people are talking about herd immunity and that being the solution to this situation, and by herd immunity, we were talking about getting herd immunity by everyone getting infected or 60% of the population being infected. What we've seen is even those countries that have been most devastated by this pandemic, they're sitting at only 5 to 10% of the population being immune. So that's a fairly small number of people that have been exposed to the virus, but a massive amount of devastation and a large number of deaths. So, we're sitting on very, very low numbers of people that have been infected in Australia. And so we would have a very low number of people with antibodies. And then, of course, the next question that we don't know the answer to is how long those antibodies last. So how long does immunity last? And, of course, this is a brand new virus and we've only had 6 months of experience with it. So we don't actually know the answer to that question.
Sophie, do we know how well people who've had COVID-19 are recovering?
Well, to a certain extent we do. Like Dr. Valley said, we've only had this virus for a few months, so we can't look at the long-term impacts yet because it hasn't been the long term yet. We're still only really in intermediate terms. But for some people, the majority of people will have a mild illness and they'll recover and they'll be fine. But there's increasing research and evidence to show that that's not always the case. And that's what we're seeing, particularly overseas, when we're looking at the research and from China, from the United States, from the UK. We are seeing people with this serious lung damage, with young people having problems with their heart, inflammation of the heart. And that's not something that they're going to get over quickly, if at all. And that's probably been missed in Australia because we haven't seen the cases here where we're getting people with those sort of, which is good that we haven't seen those cases here. But certainly that's why we want to look at it as a story, because it's really happening, quite commonly overseas, that people are getting these long-term or intermediate-term effects, and they're not recovering 100%. They're being diagnosed with things like heart inflammation, long-term lung damage, and even things like I mentioned before with chronic fatigue-like syndrome. So that's a difficult thing to say to a young person who, thought they were just getting a virus. Oh no, we actually think you're going to have, now you've got this chronic fatigue-like syndrome that's not going to go away. So we are just so lucky in Australia. And I just wanted to pick up on what Dr. Valley was saying, that it would be great, I think, for the government to run a public campaign to thank Australians for the effort that they made, because that's really one of the main reasons we're in such a great position, because of the effort that everyone put in to stay at home, to socially distance, to wash their hands, to do the right thing. And, what's happening in Victoria, it may be that we need to do that again. But I think we need to say to the Australian people that thank you for making that effort that's got us to where we are today, because without that, we wouldn't be in the good position that we're in right now.
Sophie, Vicky Sullivan has written in saying, and a number of people have been writing in saying they know people personally who live overseas who are taking many months to recover. And like you say, there are many, many others who are recovering well. Dr. Valley, I wonder whether sometimes when we report on coronavirus and we talk about the death rate, which is relatively low in Australia, that we're looking at the wrong thing, because the long-term effects, all the other sort of symptoms and conditions that continue for a long period after recovery is really where the story is.
Yeah, absolutely. I mean, it's certainly a large part of the story, or an important part of the story, because people who have severe illness, and severe illness in this situation do seem to have long-lasting effects, and that's to be expected, because whenever you have a serious illness, and particularly anyone who ends up in intensive care or ends up in hospital, they're at much greater risk of having either medium to long-term symptoms. And if there's one thing we've learned about this virus, and this sort of picks up from, I guess, where we started, in that it is not just a cold. It clearly has effects on various parts of the body. And, you know, I hope that it doesn't turn out to have, you know, it doesn't turn out that there are much more severe long-term symptoms. But you know, it's a very serious infection, and so we're going to find out a lot over the next few years, especially tracking those people that had severe disease.
Okay, Sophie, bring us up to date with where the search for vaccines and treatments are right now.
Well, look, so let's start with treatments. I guess the one that was everyone had pinned their hopes on, the hydroxychloroquine. That's turned out to be a bit of a dud. The US government is now stuck with millions of doses of this drug that actually the FDA is saying don't use it. So that's been very disappointing. The dexamethasone was a study put out a little while ago by a press release. We didn't really know, was it that good? Well, they actually put the full paper out this week and it showed that it actually did make a difference, but only for people who were on respirators and quite ill. So that particular drug would not be something that would be given to people, you know, early on, but it's been shown to be useful and reduce the death rate in people who are quite ill. That's our best sort of so far. The vaccine, well, there's 100 different, more than 100 candidate vaccines being trialled at the moment. We're hopeful, and everyone's hopeful that there will be a vaccine, but it's going to be tricky. There's no other vaccine for any other coronavirus. It's been very, very difficult. While that is the holy grail, that will be the game changer that everyone's hoping for. There's a lot of money being spent on this, a lot of really good science as well. So, you know, quite a few vaccines already in human trials, which is great. But I don't think, you know, best case scenario would be, and I'll hear what Dr. Valley has to say, but I'd say, you know, it would be 18 months to 2 years until we could get a vaccine. And that would be our best case scenario. But fingers crossed. Because that will really make a massive difference if we can get that.
Dr. Valley, that does seem like a very long time away.
It does. And I mean, I guess it's, you know, vaccines are very hard things to produce and they take a lot of time. But we're putting a lot of effort into it, and it's probably hopefully a pretty good metaphor for today when the women have won the right to host the World Cup. But what we're aiming for are as many shots at goal as possible, and if we just get one of those shots in the net, so out of those 100 or so trials or 100 or so development vaccines that are in development, we just need one of them to hit the back of the net, and you know, that's going to make all the difference.
Dr. Hassan Valley, Sophie Scott, terrific to be speaking with both of you again on this program. Thanks so much for joining us.
Thanks, Jeremy.
And thank you for joining us on this program. Always, we'll be doing this live stream every Friday at 3:20 p.m. Eastern Time, 1:20 p.m. in the West. So keep sending us your questions via social media and the ABC News website, and we'll be back with you again next week.